Okay, we're gonna call the meeting to order, and I'll take approval of the agenda. So move. Second,
I so move.
all in favor?
Aye.
Sign, okay. Approval of our December 12th meeting. Take a motion of approval.
I'll approve.
Is that a
Rita made a motion.
Okay, Rita makes the motion. Anyone second?
Second.
Okay, all in favor?
Aye.
Aye.
Sign. Okay, public comment. Do we have anybody? Nope. Like it, okay. Receipt of information from supervisors not stated as committee members. Anybody here? Nope. Okay, number 6, we're gonna finalize the 2024 work plan.
And I cannot finalize it as we are still waiting for some confirmation on the type of financial reports the auditor is wishing for us.
Okay,
So Shabana and I have worked together to streamline this. So it makes sense for the Veterans Office, for Golden Age Manor, for child support. So they're not coming what seems like every month.
yes,
So I promise to bring you the finalized work plan in March when we meet again.
but this is our old one that we were working over that we wanted
Yeah,
tweaked.
yeah.
So, yeah, just to be clear, committee members, the BSO stuff is gonna get shows up a
Yes.
bunch here. Okay.
Yep. Mhm.
Anything else on that, Tanya?
No, just that it will make a lot more sense to when we call people for their reports
Okay,
and what this board needs.
okay.
We want it to be very meaningful for you guys.
Well, and I think it's good to not use their time, to just kind of calm and tell us stuff. Moved along. Appreciably.
Yep.
Okay, number 7 is BHHS accomplishments.
Okay, that's me again. First though, if it's okay, oh no, I got that down. My partner crying here, so we'll wait. Suspense will kill you guys here.
Consider.
So what I had done was gone through our last year and to acknowledge the level of support and accomplishments of this committee. So I'm just going to list them off. If you have any questions, shout out. So the first thing was that the support of that shared use command center vehicle, which we're still working on. You supported us through the WIC merger with the 4-county WIC merger. Obviously COVID and our response to that pandemic, which is now, I believe, endemic or close to it. Heard just recently presentations on harm reduction as it relates to fentanyl test strips. I know that Chair Middleton also supported us along with the committee to complete our DHS 140 review. We do have the findings back. We are remain at the highest level, which is level 3. So that was good news for us. Through the budget process, lots of meetings and talkings on what the budget looked like. Supported us as a leadership team to go to the Human Service Day at the Capitol and advocate for human services needs. There were several resolutions, even though I believe that 3 count as one resolution regarding housing. So we started out with 21-23, which morphed into 28-23, and I believe the final product was 35-23, which is the Municipal Housing Partnership Program. So good work on that. Also supported us through the transportation feasibility study, which we've got some really good and exciting things coming through the ADRC on that regard. It was our community health needs assessment year, so you were partners with us on assessing the needs and then also developing the community health improvement plan. And then the resolution that is also now going through several iterations, started with 19-23, which was to, oh no, this was the part for Dana. 19-23 was with their funding model, if you remember that the funding got cut. I believe Dana is on if there's any questions on that, or she will be on. If not, she had given me an update, so I'll wait for her to speak on that. She said good news and bad news on that. And then the last one was 48-23 for the ban on fentanyl test strips, which did not make it out of this committee, has been heard in Public Safety, Public Works, and I believe now it's going before County Board next week with amendments expected. It's a lot.
Phew,
Yeah,
thank you, everybody.
thank you.
Thank you, staff, holy buckets. Oh, and you know what, on that note, I'm gonna send this around, but Claire did a good job of getting us some coverage on the alcohol and tobacco checks. And we got some coverage, so.
Yes, that was the
Did you, I'm a,
press release that we. Compliance checks.
yeah, I mean, it's a little bit dated, I was catching up on stuff, but anyway, thank you for doing that, that's, because we had asked in committee, we were like, does this stuff get out? So that's good.
We wanted it to go before committee first and then we sent the.
No, yeah, that was, and I guess we haven't met since then, so, yeah.
Correct, yes.
Okay, and how about are you done on that then, Tanya?
Yes.
And are you taking number 8, the VHHS survey?
Number 7, number 8, yes. So I thought Kathy, we will send it out through SurveyMonkey, or if there are paper requests, we'll send it out that way, but SurveyMonkey is the best way to do it. So watch your emails, we'll get that sent out to you.
And this is the one that we do every year, how's it world going?
Yep, I think there's 3 or 5 questions, something like that.
Got it, okay. Okay, number 9,
Okay,
this is the drum roll?
Yes, okay, so as you know, John Denny's, our chief medical examiner, retired. I think his official last day was January 2nd. So we've been working on his replacement for fall of 2023, right?
Pretty much, yeah.
So we were lucky to hire one of our deputy medical examiners on as a chief medical examiner. So Jamie Holscher is sitting next to me, and I'll just let her talk a little bit about her experience and come into Polk County.
Yeah, so I'm originally from Somerset, and I got started with the Ramsey County Medical Examiner's Office. Roughly, I spent 7 years there. So I was an forensic autopsy technician for about 4.5 years, which meant that I assisted the pathologist directly, performed the autopsies, and I really got my experience in the back. And then I also did about 3.5 years of investigations for Ramsey County as well. So Ramsey County actually is the chief medical examiner for about 15 other counties in the state of Minnesota, and they provide autopsies for a lot of western Wisconsin counties as well. With that, I moved back over here in Polk County during COVID, during 2020, and we moved back here, and I realized I just had a very specific set of skills, so I reached out and I asked if they needed any assistance and the deputy medical examiner, and then just kind of made that transition over here, and I worked both jobs. When John decided to retire, then I spent most of 2023 very much shadowing him, being more present within the office, and just kind of voicing my desire to create a more accessible medical examiner's office, and by making it have some sort of office hours and some sort of routine. That way it can be a bigger part of the county. I'm a nationally certified medical legal death investigator, so those are my credentials. That's something that I have to upkeep every 5 years, every 40 credits, ongoing continuing education, and that's that should about cover it. So thank you for welcoming me. Thank you for welcoming me to the county. I'm very excited. I think there's a lot of potential here to just be more present. And I hope that if you guys ever need anything from me, whether it's data or opinions or projects, I would very much welcome you to come and talk to me. We have so many different opportunities that I can work with you guys, and I would like to really take advantage of that.
Yeah, and I think what I would like to do then is have Jamie come back in a couple months once she's got her feet under her and has an idea more of the operations. I know she's meeting with sheriff now and funeral directors and doing all of that stuff. So just kind of in the organizational phase at this point.
Yes.
So we'll bring her back for a report sometime later this year. That's okay.
Yeah, if you could, I'd love to hear your ideas, because obviously this is not our skill set. So,
Yeah, the biggest thing, that I.
I mean, not to be on
It's
the,
okay.
right now,
Oh,
go ahead, as much as you feel comfortable with, or
Yeah.
when you come back, I didn't mean to put you on the subject.
No, that's okay, just to really be a big presence with, with public health. It's, there's a lot of potential there, and I'm hoping to be I'm hoping to be a tool for you guys too.
Could you say more about
Great.
that? How do you see that?
Yeah, so the biggest thing is the potential for reviews. So whether it's quarterly or twice a year, especially with, Children and Family Services, whether it's infant mortality review boards, whether it's infectious disease review boards, or even if it's something where I can take the data from car crashes, how many accidental deaths, how many natural deaths, the age range of those natural deaths, environment, that kind of thing. So what we actually started to do in 2023 was we got a web-based computer system that holds all of our cases. And that's been a big part of the beginning of the year for my job, is to make sure that as much of that information is within that database, so then anyone can come up to me and say, hey, I would like to have statistical reports of this, and we should be able to access it and get something on paper.
So along those lines of statistics and data, can I give you a hypothetical?
Yeah.
Right, so let's say 1,000-pound person passes away. And they're on a table, and you're doing a postmortem. And you determine that that it is a heart attack, right? What other, and let's say that you notice that that there's long-standing other issues, like there's arterial problems, there's diabetes.
Yep.
COPD, oxygen. You just like chalk it up as a heart attack and move on, or I mean.
Yeah, so
data,
I like
data, right?
Yeah, I like to have more answers than sometimes family members might like. And it depends with family members. That's a big part of it. Things like a heart attack, it's one solitary thing, but is actually within the state of Wisconsin. You cannot list myocardial infarction. The state of Wisconsin says typically this is a reaction to some underlying form of disease. What is that disease? And so really, and then there's also a different section within death certificates that ask for other contributing factors. And with that, we'll usually go ahead and get medical records and list all of those other contributing factors. So then they're listed both in the death certificate as well as our database.
So I would think that those are contributing factors. Like, any kind of root cause analysis is going to be extremely helpful to this department.
Absolutely, and those.
And not only that, if I may,
yes,
things like alcoholism and chronic drug use. So you have to have supporting data if you're going to work to support programs to prevent those types of things.
Yes.
So I appreciate that. Thank you.
Absolutely. There's physical things that can contribute, and there's social things that can contribute. And sometimes those social things turn into chronic health conditions. And I like to have that information. The state of Wisconsin likes to have all of that information. We can't just slap natural causes and call it complete. We have to add that information in there. So that's my intention, because I also will have the time to go through and do that as well.
How do you feel about tox screenings?
I think they're very, do you mean
Toxicology.
talk about as a forensic completed report, or as more of a field
'cause I know
test
that's
situation?
I know that St. Clair County is doing, has that ability now, so.
I don't want to comment too much on St. Clair County because I don't work for St. Clair County, but from my understanding is that there are two different types of toxicology. You can have test screenings, which will give you an idea of what you're looking for, so that you can order a more specific forensic toxicology test. And then you have the forensic toxicology test, which is read by a forensic toxicologist. So I think one is a resource and the other is a solution. And it depends on whatever kind of trend we're looking for. There are two different types of drug tests that we utilize through NMS labs as of now. One that focuses more on kind of the standard drugs that we've seen historically, and then another one that specializes in more of the synthetic drugs. There's a cost difference between them, so any kind of field testing, or I believe that, I don't wanna mislabel that machine that St. Croix County has, I think their intentions might be to use it more of a screening process to say, hey, is there the potential of synthetic drugs to be here? If so, what tests should we order? I don't necessarily think that they wanna keep everything internal, but again, I don't work for St. Croix County, I'm not sure, and I do know that it is relatively new. And it is something that the chief medical examiner, Patty Shackner, is very excited about. And I think that the potential for growth is always there, and we'll just have to see how they use it.
Perfect.
That's super interesting, and that was a good question. I just,
Yeah.
we have had so many discussions in this committee about the drug problem in Polk County, fill in the blanks. And one of the things that came up with John was he was able to give us some of the early data about what deaths were. So if we can start to kind of, sounds like your database is gonna firm those numbers up and have more, I don't know if it's a routine toxicology scan, but if we can start to build the case of getting real data around what's going on with our deaths in our county, that would really help this committee.
And the lab that we do use is the same that Ramsey County uses for their toxicology testing as well. So I do know that there are some overdose cases that we have done where we have done our own toxicology testing without having to go and do a full forensic autopsy. So we have, that's a lab that I'm very familiar with, the send out process I'm familiar with, and that's something that I've used for the last 7 years of me being within this field. So I very much trust the laboratory that we use. We have a contract with them. They're great. So if it's something where we just want the paperwork of the toxicology testing, that's what we're more concerned about, absolutely, that's a resource that we can use as well, and that we have used.
Madam Chair, Amy, I got a question. Is our autopsy contract still with Ramsey County?
We do not have a set contract. I hate to use this term because it's typically reused for food, but it's kind of more of an a la carte, where if we contact them and we say, this is a case that we would like to use for autopsy. And then they provide that autopsy, they will send out for toxicology testing. If it's a homicide or something that needs extra evidence collection, they will perform that for us. And then they give us a report, their autopsy report, which I consider post-mortem medical records. So they provide me the report, and then I complete the death certificate based on that report. So
Do you happen to know how many autopsies we had in last year?
I don't have the number right in front of me.
We can bring that back.
We can bring it back, and the main issue that we face, that I've heard in the past of us having a set contract with a set medical examiner, is that you're asking to predict an unpredictable thing. Where if we're only slotted for having 20 autopsies, and God forbid, knocks on wood, we have some sort of mass casualty incident, or we have higher numbers, or there's some sort of drug epidemic that comes through, and now we're left not knowing what to do because we've reached our cap.
And I'd sure like to say welcome to Polk County. It's we're very fortunate.
Thank you.
Yeah, welcome.
Thank you.
And last thing I had is, just as you're going through, one thing we also talked about, John, is budget stuff. So if you run into budget caps, this is the committee that will advocate to help to create that story for you to make an argument for line 10. And look at him.
There you go.
Okay, anything else? Okay, all right, thank you,
Well,
welcome.
thank you.
Glad to hear it. Wonderful.
Thank you.
Okay, Health Department Level 3 status, whoop, whoop.
Right, so that was back in November. which we've been preparing for our 140, DHS 140 review for the entire year. I think they put us on notice, was it October or November that they came?
Yeah, it became in November.
In November, so we had a year, which, I mean, every 5 years, we give an update every year, but this was the big one where they actually come on site. You had the opportunity to come down, Mo also came down, we caught the tail end of that review, we could say it was intense. When we walked in there, there's a bunch of state staff, our public health staff, and it was just a question and answer battery of what we're doing here in Polk County to keep, if we can, and then they make the decision if we are still considered a level 3 health department. So Helen, do you want to speak to what the level 3 entails? How we were able to achieve that?
Sure. It used to be back in like 2018. So the last time we did the review, to be a level 3 department, the requirements were like, how many programs do we have? How many programs, what are they, and the sheer number of them. The DHS has made a change, so now it's looking at to be a level 3 health department. It's more about like your strategic work within the county. So think about that on care, like how are you working on policy development? How are you collecting data? How are you sharing the data? How are you working with community partners to work more effectively, not necessarily just harder by yourself? So it's all like that connection piece really is what level 3 is looking at, in addition to doing everything that a level 2 and 1 department also has to do. So requirements for like communicable disease, surveillance and intervention, environmental health services, like at some of the, like the bigger, just the foundations of public health. So we have to be doing all those, plus doing all this strategic work within our county, so.
Yeah, it seemed like
How many levels are there?
Just 3.
Okay.
we're the top level.
We're the top.
Gold. Gold star. Thank you for that hard work. I know you guys put in some big work through the year and it was kind of a big push, so thank you.
Yeah, it's interesting just coming out of a pandemic and you know, the response over the last 3 years. We were able to use some of those examples to speak to that coordination piece, but then also I think health departments had been somewhat dismantled in that intense response for 3 straight years. So it really speaks to resiliency and commitment of our staff. So kudos to them.
And will this be announced at, I'm sorry.
I think Mo will announce it in your administrator updates.
You're gonna have the pom-poms and stuff?
Possibly not.
Denise.
Well, after working extremely close with Washington County, being on their health alert network and working with Jim Kelly over there. And also working with the Sacred County Health Department. This one is the shining jewel out of the 3. And I'm pleasantly surprised. Okay, for 2 reasons. The county's pretty small comparative to Washington County and Sacred County. This I'm not surprised about the staff being qualified and exceptional, but I am surprised at the level of productivity, I guess you could say, for lack of word, and able to manage all of those programs in light of some resistance that I've seen. And that speaks a lot for y'all's leadership in the department. And I personally would love to thank you about it. And
Helen, how many, 72 counties in the state, how many are level 3?
Oh, I was trying to find that number.
There are tribal health departments too, so there's more than 72 health departments in the state.
I was just looking at county level,
Countywide?
just at the county.
I don't have like the exact number, but I want to say it's close to like 50-50, about like 50,
Okay.
or like half is about level 3, half is about level 2, and then just like 1 or 2 that are level 1s.
I give you a lot of credit because I remember when the first time the county went under that, when Mrs. Sampson was here. And I know it takes an awful lot of work because I sat on a couple of those assessment committees, subcommittees to get that certification. And I think Doc August was also part of that.
Yes.
So my kudos to you and your staff. That's a lot of work. So congratulations. And we'll have pom-poms at the
Okay, Mo, it's not you, it's all the committee members. Okay, well done. Number 10, update on housing.
I can take this. Unfortunately, right now, we do not have any applications yet.
Okay.
Terry Howard and EDC is still, meeting with all the, stakeholders and the municipalities and pushing the program. There's interest in it, but currently, right now, we have no applications.
Do anybody does anybody know why? Is there any what's going on? Or is
We're
it
just kinda
holidays?
Just kind of waiting for that first application
Yeah.
to get the ball rolling.
Yeah.
We have
Okay.
interest in the several communities, but no paper at this point.
Mel, have questions? Okay, thank you, Mel. Okay, communicable disease report.
All right, so in December 2023, we had 14 COVID hospitalizations, 14 influenza-associated hospitalizations, and 5 RSV associated hospitalizations, 4 chlamydia, and then just kind of like 1 hepatitis B, just those other random ones.
Did we have an infant mortality too in the state or in the county?
Not in the county, in the state.
State.
And I believe it was influenza.
I know it was respiratory.
Yep, it was respiratory. I believe
RSV.
it's influenza.
Terrible.
Madam Chairman, can I make some
Yeah.
comments too, in addition to her, so that's very good information. That you're giving us those, because basically, those are the only valid information. Dr. Mike Osterholm from the University of Minnesota, who I listened to all his podcasts, and so basically, you can't, most people do their home tests for COVID and they don't report it. So the only valid statistics are hospitalizations and deaths. And
No deaths.
so we're happy that we don't have any deaths. And I just listened to his broadcast for December 28th last night, and he said there were 25,000 COVID patients in the hospitals in the US. There was 180 people a day dying. And now, then on January 5th, he was on program Almanac on Minnesota Public Radio with Eric Escala. He comes about once a month, so I get to see him in person, his image in person. And he said, we're up to 38,000 people of COVID patients in the US right now, and the death rate is about 200 people a day. And so I think that, and the problem we're having right now is we're all having COVID fatigue. And so it's kind of like, they're still emphasizing that if you're a high risk patient or older or on chemotherapy, get the COVID vaccine, the booster. And the uptake in the booster is unfortunately about 18% in the United States adults, 37% in nursing homes. And so if you do get infected, you should get this Paxlovid oral pill that you take for 5 days within 2 or 3 days of your diagnosis, if you're a high risk. And masks are still optional. So if you're old or you're on chemotherapy or you have a low white count, like my wife's brother who has a bone marrow disease, and his white counts run like about 1,000, and if he gets any kind of infection, he ends up in the hospital. And so it's really it's a really tough and go situation. And so the general trend has been, at least in the eastern part of the United States, there's a new, every month I come here and I say there's a new variant called JN.1. And, but they think it's not as quite as infection as the BA5 variant. But the East Coast, Washington DC, New York, they're seeing quite a bit of infection. So if you're traveling, wear a mask on the airplane. So it's kids are getting into type A influenza, H5N1, and parainfluenza, pneumonia. And the other problem in Minnesota is that the hospitals are really full. Well, Dr. Oscarome said Minnesota has lost 1,000 pediatric beds.
Yeah.
Because they can't afford to run them. There is very limited income, and so there's lots of peds hospitals. So the peds hospitals are 96% full of what they have, but so they've lost 1/5 of their pediatric beds in the state of Minnesota, and probably won't get any better. So I think the important thing is encourage your kids to be vaccinated for influenza and COVID and RSV, especially for the younger kids. Now they're giving RSV shots to pregnant women to give them antibodies to the baby as they're born. So it's so that's my report on what I've called from. So I get a SIDRAP report 5 days a week. And I kind of pick and choose what I tell you.
Thank you.
Amy, I'd like to give Doc a big thanks. He's given us all that information that we'd never get from the media or any other place. Thank you.
Should we start calling Dr. Doom?
No, I'm not Dr. Doom.
I know he is, but I think he's.
No, he's not Dr. Doom. I think he's a realist.
I know, that's true.
And he's a realist, and he doesn't know. He has told us. He came to our medical school class reunion 2 years ago, or a year and a half ago now, 2022, and he said, "I don't know when this thing is going to end." He said on a similar epidemic in 1890s in the U.S. that lasted 5 years.
Yeah, I don't know about that.
And so it's certainly possible that this is going to last 5 years. Well, we're in the 5th year right now. 4th year.
So when do they say it's over? Like, what are the markers that they would say?
It's not.
Yeah, right, Rita. And when would they ever say it was over? Like, what has to happen for them to say it's over? What happened in the 1800s that they said, oh, it's over?
Well, either people passed away or because there were no vaccines, there was no antibiotics.
Aye.
So,
Okay, thank you.
Bring out your dead. Quit hearing that.
Anything else on that, on communicable diseases? Thank you. Okay, legislative event report. It's been the holidays, probably nothing going on, John?
I don't know if there's been anything.
Nothing?
do we still have that? John, do we still have that legislative event report?
Yeah, I think they begin, I've got some dates, see, I'm on 5 steering committees, and our Health and Human Services, they don't actually have a date yet, but
Okay.
it'll be, I'm imagining and I'll be home last 2 weeks in March, so it'll be in either last part of March or first part of April. I'm thinking probably first part of April, but good Lord willing, I'll definitely be there. And as soon as I get an agenda, Amy, and I'll pass it on to you guys. I always get you the agenda.
Thanks, John, for tracking that.
In the past, we met in New Richmond at the county building. Well, first it was on the poor farm. And
Nice building, yeah.
then it was at the county building.
I think those got discontinued.
Doc, it's still nice to. It's still nice to know somebody that's old enough that when we called it the poor farm, because that's actually what the sign said.
Okay,
That dates me.
Do you want to check in with Dana?
Yep, Dana's on, so do you
Okay,
want that?
can we go to Dana now?
Dana?
Dana, we're gonna
Where's that survey?
touch base with you on budget stuff, if you can hear us. There she is.
Yes, hello,
Hi, good morning.
hi. Morning.
Do you have an update for us on how things are looking on your end for the budget issues that we were talking about last month?
I do, I finally got some info, good and bad. So basically, we got our update last week that, we will not be receiving any supplemental payment for this year. So we were kind of expecting that. I'm just gonna pull this up on my other screen here, with how the calculations were going. So basically, our revenues are greater than our expenses, so we do not meet the criteria within, the new methods for the supplemental payment. So there's 40 facilities, 16 of us are in that same category. With that being said, we also saw a 10% increase in our Medicaid reimbursement from 2022 to 2023. So that's extremely positive. And basically with how they're calculating the supplemental payment, the only way that we're gonna see anything come from that is if our expenses increase. So for example, our, the per patient day cost for some of these facilities that are getting funding is over $300 more than what our cost is per day. So again, we've always tried to control costs, and that's what we've done a good job of. But unfortunately, that takes us out of the mix for the supplemental payment. But with the increase in our Medicaid revenues, that's really helping us and going to, make things okay for us in the budget the way it sits now.
Thank you. Questions?
What's our occupancy, Dana?
We're right about where we've been for, like in terms of Medicaid occupancy, I guess is what we're talking about here. We're about 65 to 70% of our total occupancy, but we continue to stay our census around 60 to 65.
With the majority.
Dana, do you think that resolution that I got passed at the General Assembly, do you think that got down, that it did any good as far as allocation or will in the future?
I mean, honestly, it didn't seem to. It seemed like DHS already had their plan for how they were going to implement this. It was definitely, it was a great idea and thought, and I'm thankful we did that. But I do think that DHS already had that, had it figured out before.
That was exactly the feeling that I had from the people that I contacted there. But
Yeah.
at least what we did was we made them aware that that northern Wisconsin, that our situation was really dire, and that we have more need and more population than what they realize down there.
Yep. Yeah, it's always great to get that awareness out there and to, be heard for what it's worth, right?
Oh, that's why we're there, and that's what Polk County was lacking pretty much in history. We just sat up here, and if you don't reach out, you don't get any help and recognition, and it's helped immensely, I think.
Yep.
Anybody have questions else? I have a question, Dana. So the revenue and expenses ratio, we're making more than we're bringing, our expenses are, below what we are bringing in. But the reason for that, the way I'm thinking about it, is because you had to cut beds. So what if we changed our budget and added in some more back those beds?
That's a good question.
We've been losing, and then make our ratio look like we should have this help, and we could serve our population more and get some of this funding that we really should be getting. Am I thinking about that correctly, and would that work?
Staff too.
Say that
That's
again,
fine.
I'm sorry, I wasn't quite following.
Well, you said we're not in the mix in Madison for the funding ratio because
Right.
our revenue is more than our expenses. But that, in my mind, is because we made cuts in beds. You cut out the staff, and maybe you couldn't staff them
Right,
also. But
right, and that, yep, that's definitely a part of it,
Get better.
and basically, you know, just the very obvious explanation is we have to spend more to get any of this, and that's what, you know, a lot of these facilities that are in the mix are spending. Like I said, you know, Dane County spends $320 more per day per patient than we do, which is just insane. And you know, without seeing their cost report and all of that, I'm sure most of that is on personnel, is on direct care, is on, you know, I'm sure some of it is on capital, but I'm sure a lot of it is they're spending it on their wages. And that's just it. If we did, you know, increase capacity or census, we would have to staff that, which is the challenge.
That's a challenge.
Do we have some capital improvement planned for 24?
We do, yep, we do have, you know, we always put 200,000 is kind of our standard capital that we have in the budget that we plan to keep, you know, chipping away at our, you know, 60-plus-year-old building. It definitely takes that funding to keep it operating and keep it, you know, working well. So we definitely have plans for that funding, or for that money, I should say.
okay, thank you. Anybody else?
Well, I guess in the plans for 24 is our biggest petition is to the legislature. Everything comes out of the biennium, and hopefully that we can make some noise in the legislature with our representatives and that. And I hope everybody in the county feels free to make our legislatures aware of our situation in Polk County, that the needs we have, because all the funding comes out of the legislature.
Right, yeah, thanks, John.
Yep.
Anybody else? Okay. Are we already, oh, go ahead.
Do we have a transportation report? Anything?
I know that ADRC has a couple of recruitments out for the grant, because they did get the grant. Not as much as they had submitted for, but they got enough to fund the mobility manager position. So I think that's out on the website right now.
It is, yeah.
Mhm. And we've heard, as we've been presenting transportation dilemmas to them, that this will help a lot with our specifics and trying to get people rides.
Great. Go
I
ahead.
just have one thing I'd like to share with the committee. Midweek last week, received notification that the Centers for Medicare and Medicaid Services has made some revisions to their ruling that will allow individuals who are licensed marriage and family therapists, as well as mental health counselors, so a licensed professional counselor, to be able to see individuals who are covered under Medicare. Prior to this, it's been a fight for as long as I've been in behavioral health, about 30 years, to try to move forward that, so that more elderly or those covered under Medicare could receive services. And it's been approved. So
Wow.
we're in the process of getting 3 of our providers credentialed with Medicare so that we can increase the number of Medicare patients we can see.
Do they have the staff time to take on that increase?
We get a lot of calls. You know, we typically, from the capacity perspective, for therapy, if we are booking an intake more than 6 weeks out, we refer out, just because we want to get people plugged in. But I would still say that Polk County Behavioral Health is probably booking sooner than most other organizations. But we've been getting an increased number of calls for Medicare. So
Okay.
So are your people certified now?
No, it just came out last week, so they have to get set up in the PAYCO system and then get their numbers set up, so,
Sure.
but we're excited moving forward.
Well, I think that's what,
Their licensure says they
they
can
have
do
the
it, they just have to
correct
get
license.
Well, yeah, they have a correct licensure for that, they have to
Okay.
just get set up with Medicare as a
Sure.
payor.
sure. Well, I think that's wonderful, I think for our elderly population here in Polk County.
It just opens some opportunity for
Well,
us to look at additional program at some.
And all the
point.
other providers too now, they can, at St. Croix or Amory, they can credential their staff too.
Right.
Yeah,
So it's not just for us.
It used to be
it's for
just
all providers.
LCSW, so a
Yeah,
licensed
it
clinical
was
social
an
worker.
MD, DO,
Now it's been
PhD.
Opened up to
LCSW.
marriage and family therapists, LPCs.
Yep.
That's so great, because there's such a need, nobody can get in anywhere, okay.
There were
Anything else?
workarounds, but they were invitations for audits
Yeah,
in the olden days.
we didn't go there.
We didn't go there.
Anything,
Probably come over there.
thank you.
Probably.
Next, so our next meeting
It's not February, right?
March 10th.
is, yeah, so February is canceled, everybody will do that, not canceled, we just keeping the tradition
Not
of
scheduled.
unscheduled. So our next meeting will be March 12th, and I had a couple items on here. So maybe you, maybe not, you guys can keep in touch with whether or not you're ready to come in. But at least give us the 2023 numbers for autopsies, just that question, maybe just put it in your report. Transportation, sounds like we should have an update on transportation report and where ADRC is at, maybe, staffing. Ryan has been working with Extension, and Lindsay from 4-H is gonna come in and talk about her youth programming work with 4-H.
Cool.
And that's all the three things that I had. Does anybody else have anything else?
Shabana mentioned rules of order will be coming, just a review to see if there's any rules of order.
Or to do edits on it?
Specific
Oh,
to
right,
Health and
okay.
Human Service Committee, so we'll review that. If there's any changes, they'll then pass those on up for when they do have the rules of order. It's in May when they do rules of order.
So
That's, we're still looking at that, so. Yeah.
So how will that work? So we'll have
It's
the
just, it's
update?
just the HHS section of
Right.
the rules of order, like what falls under your committee, those kinds of things, making sure that's all accurate. That's what this committee's gonna do, and all the other committees, and executive kind of takes all of that into consideration to pass on the final draft. to the council.
So in March, we'll get like presentation, and then in April, people come back with tweaks. Because people won't necessarily go on the fly, look at it and say, have any comment.
The section will be out with the agenda.
Okay,
then
so
it'll
come
be looked
prepared.
at, and then.
So
it'll
come in
be
March
changed.
prepared to make changes. That's what you're saying.
As of right now, yes, but that may change.
Okay. So
I
that's
have-
your homework.
I also have CJCC, because you were asking for a CJCC report.
Oh, yeah.
Melissa is back from her leave, so we will put her on the March agenda if that's okay with you.
Okay.
I will be out of the country in March, so I will not be here, and then I also may not be here in April because I may lose my election.
Oh.
So I just want to say, and also I have a gig that day in with the Minnesota Hospice and Palliative Care. I'm the closing speaker for the conference. So this might be it for me. Who knows? So I just want to say thank you. It's just been
Thank you.
huge pleasure and honor to be part of this committee, and hope I'm back next year. I'll give it my best shot. Yeah.
Thanks for sharing the leadership with us, Amy.
Well, that was
Barbara,
We have a
Barbara.
deep voice, same thing.
same situation for me, probably.
Well, you might.
Okay, I will be at these meetings. All right, anything else? Last call? Take a motion to adjourn?
I so
Denise.
moved.
Second, John. Thanks, everybody.
Thank you. Thank you. What did you say? Happy New Year.
Thank you, you too, Rita. Bye.
Happy New Year.
Happy New Year from sunny Arizona.